Okay, we're going to be doing part 19 here of Prevent and Reverse Hypertension by me. Pete Rogers is the book. It's available at Amazon. We're going to talk about normal variants which motivate you to be meticulous in your diet and lifestyle, because some people have anatomy in their brains and their hearts that predisposes them to increased risk of stroke, increased risk of heart attack. And when you realize that, then it makes you more thoughtful to try to do things as well as you can, rather than just say, well, at least I'm not as fat as my cousin. So here is what is called the circle of Willis. These are the arteries at the base of the brain. I've seen tens of thousands of these. Okay, I look at these things all the time. And I'll often see it. I see it every day, this normal variant whereby the basilar artery, which runs along the anterior surface of the brainstem, the pons, is very small in diameter. The medical word for that is hypoplastic. And the way it develops is that you've got two arteries in the front of the brain called the carotid arteries, and you've got two arteries in the back of the brain called the vertebral arteries. They're called vertebral because they run along your vertebrae. Normally, the vertebral arteries, let's say they're about half as big as the carotid arteries, okay? But sometimes, and in the fetal development, you have big, what are called posterior communicating arteries. These arteries right here are big. And posterior communicating artery is called the PCOM. And in utero, the fetus will have big PCOMs, and then with time, the vertebral arteries get better developed as the baby grows, and they become larger, and they take over most of the supply of the posterior brain, like the occipital lobes. They take that away, the posterior cerebral arteries. They're filling from the basilar trunk rather than from the anterior circulation from the carotids and the PCOMs. Okay, so why am I going through all that? Because in some people, these things don't ever atrophy. They don't ever become vestigial, the posterior communicating arteries. They stay big. That's called a persistent fetal type PCOM. And when you've got bilateral persistent fetal PCOMs, then because you don't need to make a posterior cerebral artery coming off the basilar, it never gets big. And so you end up with these chronically small vertebral arteries, chronically small basilar artery, and they're more likely to get mural thrombus, clot along the wall that occludes the penetrating branches going into the brainstem and cause a stroke. Okay? So you don't know if you got this unless you do an MRA, magnetic resonance angiogram, CTA, CT angiogram, or a catheter arteriogram of your brain. Okay? So the smart move is just assume you do and be meticulous about eating low-fat diets. Okay? Now here's another diagram just showing you how some of this plays out. Okay, so here is the hypoplastic basilar artery. It runs right along the anterior surface of the pons. This is your brainstem here. So this would be the medulla. This is the pons. This is the midbrain. The cerebellum is posterior to the pons. And then off the top of the basilar artery, you're going to have these posterior cerebral arteries that are going to go above the tentorium cerebelli. They're going to go into the occipital lobes. And what I'm saying is when you got a hypoplastic verts and a hypoplastic basilar, it's much more at risk to clot off, as well as to just develop mural thrombus, atherosclerotic plaque along its posterior wall, and occlude the pontine perforating arteries, and some of the branches go into the cerebellum. And so I see strokes significantly more often in patients who've got this anatomy, because it doesn't take much to develop mural thrombus, clot along the wall of the basilar. So that's why you want to be low-fat vegan with no oil. Don't mess around. All right, so that's the risk of stroke. Now I'm going to show you the risk of heart attack related to normal variants. Here is your ascending thoracic aorta, and arising from that, you got the aortic valve here, the valve cusps, and you've got the left main coronary artery. That's the one when that gets a plaque. It's called the widowmaker. They always exaggerate how common that is. Here's the left anterior descending artery, the circumflex artery, and normally it's a bifurcation in the left main into the left circumflex and the left anterior descending. So this wraps around between the atria and the ventricles, the circumflex does. LAD goes right down in front along the anterior surface of the heart, left anterior descending artery. The point of the matter is some people, instead of having a bifurcation here, they got a trifurcation. A trifurcation means there's three branches, and the net result is that these other branches are going to be smaller. The smaller an artery is, the harder it is to put a stent in there. The harder it is to do a surgical bypass. So you're going to have technically more challenging arterial territory to stent or bypass when you got a ramus intermedius third branch trifurcation. Okay, so it's going to be harder to revascularize, so to speak, with stenting and cabbage. And what I'm saying is just assume you got that, because you don't know you got it until you image it. So assume you got it and realize that you're going to be harder to revascularize. All right, now here's the other thing I want to talk about. These are the intramyocardial arteries. Intra as in inside, muscular and myocardial are essentially the same things for our purposes. And they penetrate into the muscle, let's say the left ventricle. This would be called the microvasculature. On a cardiac cath, also called a cardiac angiogram, you can see the left main, the circumflex, and the LAD. You cannot see these intramuscular branches. You cannot effectively see them. So what that means is, and they're also real small, you can't stent them, you can't surgically bypass them. And what you worry about is small clots getting into those arteries, okay? A person can have clean coronary arteries and have cardiac chest pain, and that would be called, angina with non-obstructed coronary arteries, like a NOCA, all right? I'm just going to show you that usually you can only stent down to about 3 millimeters in diameter, and the smaller the artery, the harder it is to stent and to keep it open. Here's a paper on coronary microvascular dysfunction and microvascular angina. The only thing you can treat this is with diet and pills. You can't treat it, like I said, with stenting or cabbage, okay? You need a systemic treatment, and diet works better than pills, so why not do the low-fat vegan diet? Women are more at risk for coronary syndrome X, same thing as microvascular angina. It's also called coronary microvascular dysfunction, CMD. People with obesity, autoimmune disease, hypertension, high cholesterol, sedentary, tobacco, leaky gut, they're at increased risk. And the thing I want to emphasize especially is these amyloid clots. I talked about those being related to 3 things, and actually 4 things. Number 1, they're most strongly associated with leaky gut, leading to bacterial endotoxins, LPS and LTA, changing the shape of the fibrinogen clotting protein from alpha helix, secondary protein structure, which is cylindrical, like a slinky, to beta-pleated sheet, flat like a deck of cards. Then they form intramolecular hydrogen bonds, and it'll precipitate out of aqueous solution, which means to clot. So leaky gut will do that from bacterial endotoxins. LPS from gram-negative, LTA from gram-positive. Number 1. Number 2, viral proteins will do it. That's 2 things. Okay, really 3, LPS and LTA. Okay, then the next thing it'll do is high estrogen levels. Estrogen also has a bit of an effect to induce these amyloid clots. They're called amyloid clots because they have a transformed secondary protein structure, which makes them relatively refractory to lysis, meaning makes them more difficult to dissolve, meaning they're bad clots, so typically 2 to 200 microns in diameter. Okay, and the other thing that does it is being iron overloaded. Most men in Western countries are iron overloaded by the time they're in their 20s because they eat a lot of meat, mid-20s, and because a lot of the processed food, it's all iron fortified, so much of it. Okay, well that's a lot of stuff that can cause these microclots. They're 2 to 200 microns in diameter. They can travel around the body, including arterioles and capillaries. You don't want that. That can plug up arteries in your brain, make you stupid, plug up arteries in your heart. So you want to avoid all this. How do you avoid it? As best you can do. Don't eat processed food. Try to eat whole food, vegan food, organic only. All that stuff works to your benefit, okay? Because I think this is a major contributor to cognitive decline and increase in incidence of atrial fibrillation. Here's just a picture of sunshine as a reminder that sun does a lot of good things for you. Of course, we know it helps, make vitamin D, but it also releases nitric oxide precursors from your subcutaneous tissues that give you systemic vasodilation. So while you walk out in the sun, you feel good, okay? The researcher, Senef, she believes that it's increasing sulfation, sulfate, negative charge addition to your endothelial glycocalyx, which is a good thing, to improve the zeta potential of your endothelial glycocalyx, meaning make it more resistant to clotting. That's all good. And the latest thing I heard from this guy, that was at MedCram, Roger Seahold. He's talking about, he showed a paper, I thought it was really cool, about the idea that sunshine, the red light in particular, is thought to partially liquefy the fluid in the mitochondria located around the ATP synthase. Can induce a phase change. This gets back to the idea of Gerald Pollack's 4 phases of water. Water, we were all taught in the good old days, was liquid, gas vapor, or solid ice. But there's a 4th phase of water where it's a gel form. And think about it, if a person has a traumatic injury, they bleed blood, okay? They don't bleed water. Well, for 60% water, why wouldn't we bleed water, okay? We don't, because the water, other than the plasma and the blood, it's in a gel phase, okay? And you can just prove that to yourself. Just take an egg, a fresh egg that nothing's been done to it, and you crack it, and what do you have? You have a gel, all right? So the relevance is it's thought that certain things can induce a phase transition in areas of the cell in response to red light. I also believe I've read in response to calcium. So that can get a part of the cell that previously wasn't very active to have more liquefied, lower viscosity fluid around it and become more active for contraction of a muscle or movement of some other structure inside the cell. It's a way to initiate movement, liquefy the cytoplasmic water in that area. Rather interesting, don't you think? So anyways, MedCram did a good job with their videos. They got videos on sunlight. They got videos on red light. So that's all good stuff. So anyways, that'll be it for today. This section of stuff we covered on prevent and reverse hypertension. I hope you found it helpful.